Welcome. If you're tuning into this presentation, you're a patient of ours at RR Dentistry, or you've been given a sheet of paper with a QR code or some form of a link to watch this presentation. My name is Ryan Robertson. I'm one of the dentists here at RR Dentistry, and specifically, my passion is airway health. And so RR Airway Health was created. And what I've tried to do is I've tried to bring dentistry and airway health together, because the dentist is actually one of the first people that can recognize that there is an underdeveloped jaw, which then in turn leads to an underdeveloped airway. And if you have an underdeveloped airway, or your child has an underdeveloped airway, and their jaws have not grown or are not growing the way they're meant to, it can cause a multitude and a mixture and a myriad of a bunch of different health issues. And we're going to get into that. So my goal today is to educate you, to let you know the why behind the problem. And also, we're going to explore together some of the options available for treatment, both for kids and adults. But this presentation is mainly for adults. I will talk about kids, but there is another presentation that goes deeper into children and treatments for them. Okay, so again, thank you. And without waiting and making you wait any longer, let's get started. Each one of us is a combination. We are a combination of a lot of different things that have been layered on top of one another to create the person that we look at in the mirror each morning. Okay? Our kids are basically becoming a combination of a lot of different things. It makes us each unique, and we have a unique sequence. Our DNA is unique, the way we're created is unique, our genetic code is unique, and the way we've developed and the way that we've moved in and out of our environments is unique. And because of this uniqueness, each of us has had years of compensation, meaning an event happens and our amazing bodies compensate. But there's a price. With each compensation, something else didn't develop the way it was supposed to. And this can't be any more true than the face and its development. The tongue, the cheeks, the lips, the muscles have a huge play on forces. And those forces have a huge impact on how our jaws develop. And if those forces are altered at a very young age, we compensate. We still survive, we still grow to some degree, but we've compensated, and that layering starts to occur. And the longer we compensate and the older we each become, our bodies have problems. Some of this occurs rather quickly, some of us it takes longer, but that's what we're going to explore together. Okay? There is a silent crisis in America, and I know that sounds heavy, but just hear me out. On the left side, our kids are developing and suffering from these symptoms. ADD, ADHD. They're wetting the bed, they're having difficulty in school, they're mouth breathing more and more. They're snoring, they have restless sleep, they have delayed or stunted growth, they're experiencing nightmares, having lower IQs, they're dealing with allergies often all the time, and we have crowded and crooked teeth. They're developing dark circles under their eyes, their adenoids and tonsils are getting swollen, and they're experiencing daytime drowsiness. And if our kids, if you, if me, grow with these, often as adults, it can lead to these. So sleep disordered breathing, this is what it looks like when children are suffering from it. And this is what it looks like as kids when you suffered and you grew to an adult. These are the things you now suffer from: depression, anxiety, fibromyalgia, obesity, hypertension, aggressive behavior, bruxism, which is grinding and gnashing of the teeth, cardiovascular disease, Alzheimer's, opioid addiction, diabetes, dementia, cancer, and premature death. And the research is clear, and it has shown that 9 out of 10 Americans suffer from one or more of these conditions. So I want to show some faces of some kiddos, and I'm asking you, are they healthy? And I want you to start seeing faces differently. This is a profile or a side shot of this young guy. And if you look at his chin, it is set back. It's set back because it's not as prominent. If I drew a line from his forehead down through his chin, it would be convex. It's meant to be straight. So just from a side view, I can tell, and now you can, that jaw is underdeveloped. It didn't grow forward like it was meant to. What about this young lady? Look at her eyes. You see the shadowing around her eyes? That's called venous pooling. Look at her chin. Her mentalis muscle, which is this muscle, is tightened. She's struggling to keep her lips sealed. It's kind of protruding her chin forward. This guy's got some chapped lips. Chapped lips are a sign that our children are mouth breathing. When they mouth breathe at night, their lips get chapped because they're getting moisture on them. He also has some dark circles and shadowing around his eyes. His chin and neck are fairly thick, which creates more mass around your airway, which can complicate breathing. This young lady has a slight head tilt. She's got some dark circles under her eyes. Notice the prominent teeth on this young girl. Her chin seems very small for her face. And this part of her face from here down doesn't seem to match the size of her skull. We're going to get into why that is. And this young lady just looks tired and worn out. She doesn't look like she's sleeping well. Why would that be? Why the tired eyes? Why the prominent front teeth? Why are the jaws set back? What's going on? There are visible symptoms that you and I see. There are visible symptoms that you and I see. We see and we experience these symptoms. Dark circles under the eyes, mouth breathing, swollen tonsils, restless sleep, bedwetting. These are all things that we see in kids, and maybe we even experienced, you and I experienced it when we were kids. Snoring, allergies, having nightmares. Did we have difficulty in school? Were we very aggressive? Maybe you or your child was diagnosed with ADD and ADHD. There is a connection with sleep-disordered breathing. But these symptoms are what we see, just like the leaves on a tree. But the underlying cause and the common theme with all of these symptoms is you can have a compromised airway. And if your airway is compromised, you're not exchanging air appropriately, you're not breathing well at night, you're not sleeping well because the airway gets disrupted or kinked and shrinks a little bit when you're breathing. And if it collapses, your body's constantly trying to get it to breathe and rest well. And compromised airway, the root cause for a compromised airway, how did we even get this way? Are narrow arches. Narrow arches and underdeveloped arches in lower jaws, or underdeveloped upper and lower jaws. Why do we have narrow dental arches and underdeveloped upper and lower jaws? Well, soft diet, weak forces. All of our food is softened. Maybe we were bottle fed. Maybe we couldn't nurse. Maybe we didn't nurse. Maybe we didn't nurse long enough. Weak orofacial muscles. Drinking through a bottle causes a low tongue posture. Maybe we were limited or we didn't have any breastfeeding. We developed a tongue thrust because we have swollen tonsils and adenoids. So we're thrusting our tongue to open our airways so that we can breathe. These are all root causes as to why we have narrow arches and underdeveloped jaws, leading to a compromised airway, which then leads to the symptoms that you and I see. I see this every day in adults. I see it when I see kids. And so you'll start to see the world differently. And it's very eye-opening. So where did these dental arches come from? You'll notice that these are permanent teeth coming in. This child's probably 8 or 9 years of age. And you see other teeth, there's not room for them. He or she doesn't even have room for her 4 lower front teeth. And here, the lower jaw is so set back, it didn't grow to keep up with the upper jaw. This is what it's supposed to look like in our kiddos. We're supposed to have spaces between our baby teeth because our primary baby teeth are much smaller in comparison to our adult teeth. So when our adult teeth drop in and grow in, they make up and take up that space. But if we have no spaces in our primary dentition, our primary teeth, our baby teeth, it lends to crowding. This is because of proper tongue posture. A narrow arch is created because the tongue is not sitting up in the roof of the mouth. And we don't see spaces between baby teeth much anymore. I don't when I see kids. So I want to get into why. You remember the photograph of the young lady where her lower face seemed underdeveloped, but her upper head looked larger in comparison? At the age of 2, this is our growth. That's how big our skull is. And you can see as we age, each of these lines is growth, all the way out to 17 years. And so most of our growth occurs in the lower half of our face. And the growth is meant to be down, wide, and forward, or down, forward, wide. But it's meant to grow, with most of the growth occurring through here, through your nose, through your lips, and your chin. At 2 years old, we're about 55% developed. At 4 years, 73% developed. And at 12 years, 89% for males and 94% in females. So we've got to get to our kiddos before the age of 12, preferably. And the normal facial growth is down, forward, and wide. So if we see a young girl like we saw, and we're seeing the prominent upper front teeth, and we're seeing that this part of her face is small, it tells you that she's not developing the way she was meant to develop. And she's going to have smaller, underdeveloped jaws. And if her jaws don't grow down, forward, and wide, she's not going to breathe well. And if she's not breathing well, she's not sleeping well. And if she's not sleeping well, there is no way she can become the best version of herself, because her body is not restoring itself at night. The deep sleep where healing comes, and pain consolidation and memory consolidation. REM sleep and deep sleep is where those occur. And if your fragmented sleep is getting broken up, if your sleep's being fragmented, you're not going to get those periods of REM sleep where you dream and you deal with the anxieties from one day to the next. So why are so many children suffering from abnormal growth and development? Why is this even happening? And if we're suffering as children, we see our kids and us, we grow up to be adults that are suffering from all those conditions, the depression, the anxiety, the hypertension, the heart issues, cardiovascular issues. So I'm going to give some clues into that. There's a researcher by the name of Dr. Robert Corosini, and he's an anthropologist. And he studied anthropology for 30 years. He has many areas of study, and what we're going to focus on for this presentation are population studies. So Dr. Corosini, he went back 400 years and he observed and studied skulls, human skulls. And what he noticed is 400 years ago, our jaws, humankind's jaws, were wide, broad. We had room for all of our teeth, even our wisdom teeth. The teeth were typically flatter because of the diet at the time, but the teeth were straight. Jaws were larger. The face, lower face, was much broader. And now, Our modern faces, they don't look like that. They're not broad. We typically don't have room. Not only our wisdom teeth, which most people can't even have those in their mouth, but we've even over the last 100 years, people have had to have their bicuspids pulled. Maybe you've had yours pulled. And it wasn't that your jaws, or that you had too many teeth, it's that your jaws were too small. So these population studies, what Dr. Corricini did is he went and he found rural populations, isolated populations. And what he found is that when he looked at these populations, he saw some common threads. They breastfed for many years. They carried their kids around with them. And as a product of that, food was always readily available for them. They breastfed for many years. They had a hard food diet. They ate what they had. They didn't make a lot of soft foods. There was little to no incidence of crowded or crooked teeth or degenerative diseases. And most of the people had perfectly formed upper and lower jaws. So his conclusions based off of these population studies that he studied of these rural populations is dietary consistency, the texture of it, and the toughness promote proper bone growth because you're stressing the system. In stress, we grow. Gravity strengthens our skeletal system. If we didn't have gravity, we would be blobs, okay? And when we have processed foods, since we are industrialized, and when we start to eat those processed foods, those softer foods, microwave foods, stovetop foods, now our muscles don't have to work as much. And so we see a rapid rise in crooked, crowded teeth because we're eating softer and softer foods. A soft diet or processed foods increases the underdevelopment of the upper and lower jaws and the subsequent malocclusion or crowded and crooked teeth because our jaws just aren't big enough because they're not being stressed enough. They're not being grown when we're kids. And so what he found after studying generations is once Western ideals, once a Western culture mindset and lifestyle was incorporated into these rural populations, by the first generation, 50% of the kids had malocclusion. 50%. Second generation, 70%. Third generation, 85%. So by the third generation, those kids developed malocclusions, crowded and crooked teeth. What generation are you? I'm well past third generation. I've needed braces. My kids need braces. I've had my wisdom teeth out. My daughter's about to get her wisdom teeth out. So his conclusions are most malocclusion, teeth and jaws not lining up well. It's acquired. It's not inherited. Because with genetic mutations, it takes a long time, 27,000 years, to express in 51% of the population. And I don't know where he got the 27th, that's a long time. What I want you to focus on is by the third generation, he saw these populations develop crowded, crooked teeth and underdeveloped jaws. Malocclusion is a disease caused by Western culture. So you might be asking, Ryan, you keep bringing up Western culture. What's Western culture? Well, we're not breastfeeding near as long as we used to. Our culture has changed. Our moms are at work. And I have been blessed tremendously. My mom worked. My wife has worked. I work with a bunch of amazing women on this team that work really hard. And that's a fact. And that fact means that they're not able to care for their kids and breastfeed for near as long as what the rural, uncivilized populations would. And so what do? Sucking on a nipple, breastfeeding, actually develops the face. You have to work really hard and develop, the muscles have a workout to express the milk. Well, if we can't do this, so then we're going to bottle feed. And the nipple, it's easier to express the milk. But it's a different habit to express the milk out of a nipple of a bottle. It's much easier as well. and it trains low tongue posture. So if we're feeding formula or we're feeding breast milk that's been pumped out of necessity, and we're feeding it through a bottle, it trains the tongue to sit low. And if the tongue is sitting low, it's not sitting in the roof of the mouth, and it's not naturally expanding and growing the arches, the upper arch. So it's narrow. And if it's narrow, the child grows differently. Their body compensates for that. And so now the teeth don't line up, and the jaws don't develop and grow. The nose is smaller. The internal aspects of the nose is smaller because the floor of the nose and the roof of the mouth share the same bone. So if the tongue is not sitting up there, widening the palate, now the nose is narrow. Now you can't breathe through your nose very well. So what do? You breathe through your mouth, and now you open your mouth, and you don't get the benefits of nasal breathing. But more importantly, the tongue is not sitting up, it's sitting down. And now we get swollen adenoids and tonsils. And these cycles just repeat themselves. And we see it again and again and again. And once we go from the bottle, then what do? We're afraid our kids are going to choke. I was. So we go to a soft diet. We feed them mashed up things, baby foods, little jars. And when we're done with that, we go to the puffs. We go to something that will melt in their mouth. They don't have to chew it at all. So even if our kids breastfed, but then we move them to an ultra soft diet, their muscles lose tone. They haven't worked out in a while. And so their muscles just don't grow their faces the way they're meant to. The way it should be. Chewing harder things, vegetables, healthy diets, working out the muscles, breastfeeding for a longer period of time. Those would be the ways that would get our jaws and the subsequent airways to grow the way they're meant to. We just don't live that way anymore in Western culture. So, his research, Dr. Coracini, most malocclusion is acquired, it's not inherited. Malocclusion is unique to Western culture, and the presence of malocclusion is the key indicator of underdeveloped airways. Dr. James Sim Wallace, he was a dentist well before his time, and something he said, an early soft diet prevents the development of muscle fibers of the tongue, resulting in a weaker tongue, which cannot drive the primary dentition out into a spaced relationship with fully developed arches, which will lead to more crowding of the permanent teeth. Our tongue is meant to be a scaffold. It's meant to form the upper jaw. It's meant to form the upper jaw, and then the lower jaw can grow into space. It's supposed to be sitting in the roof of the mouth, acting like a brace, because we don't want an arch like this. See how it's V-shaped? That's not the shape of a tongue. Tongues are round. This, when I see this type of bite and that type of alignment of teeth, I know that that tongue is not sitting in the roof of the mouth. And I suspect it's a mouth breather. Probably can't breathe through the nose. And we start looking and asking, why is this happening? Why is this happening? This is the kind of arch we want. This means the tongue is sitting up in the roof of the mouth. It was trained proper, and there's room for all of the teeth. No teeth have to be removed. And if no teeth have to be removed, nice open airway. Nice open airway, breathing, sleeping, resting well. Dr. Christian Guillemot from Stanford University says that his research and his results suggest that dental arch expansion improves SDB, sleep disordered breathing, in patients with upper and lower jaw constriction, and can be a valid treatment. So what do we do with underdeveloped jaws? We develop them. We grow them. We can do that in kids with expanders, palatal expanders, and we can do it in adults. Yes, we can do it in adults, and I'll get to that later. So there is treatment, surgical and non-surgical treatments that can help our kids grow, and as adults, if we didn't catch this in time, can help us grow or reform the developed airway that has been underdeveloped and develop the jaws which have been underdeveloped. Because we want to go from this to this by expanding the maxilla, broadening the base of the nose, getting us breathing through our nose, not through our mouths. So the airway goes from the tip of the nose all the way down to the base of the throat where it enters the trachea. So this is all soft. We go in through the nose. If we can't breathe through the nose, we open the mouth, we breathe through the mouth. The soft palate, which is right here, can block the airway. So we've got to find out, where's the blockage? Where's the constriction? What is collapsing the airway, which in turn is disrupting the sleep, fragmenting the sleep, fragmenting our deep cycles of sleep, our healing sleep, our restorative sleep, the way we're meant to exist. So what does your airway look like? If we were to take a slice, which we can do with radiographs, CT scans, are you trying to breathe through a straw, a narrow straw, or are you breathing through a garden hose? There's a big difference to your existence when you're breathing through a garden hose versus breathing through a narrow straw. So now we're going to move into actually some images of some airways. And so these colored things, these colored columns, are all dimensions of airways. This is the soft palate, this is the tongue, these are the teeth. So these are all slices laterally. Take a slice right through here, right through the midline. And so then we can observe the tongue posture, nasal passages, airway passages, and all of these are with the individual standing up in a scanner. So this isn't even laying back. Okay? So this just gives us clues. How big's the airway standing up? And if it's small, then that's a huge clue, huge, that there's some collapse. That's the disruption. As you can see here, very, very narrow. Very, very narrow here. These are adenoids, swollen adenoids, making it impossible to breathe through the nose. And so when you can't breathe through the nose, you open the mouth and breathe through the mouth. This is an adult with sleep apnea, showing the narrowness of the airway. So what I've tried to do is lay the foundation, to lay the groundwork. Right2Grow.org is an organization, it's a website that has come up with this great video. So I want you to view it because it's going to try to package together all the things that you and I have already talked about. Let's listen in.
Just a few hundred years ago, the human face was different. It was forward grown. Her wide profile and large dental arches ensured straight teeth and room for her tongue. Most importantly, she had plenty of space behind her upper jaw so she could breathe through her nose with ease. The modern face has changed. From childhood, her dental arches are less developed, crowding her teeth and giving her less space for her tongue, which impacts her airway. Many believe this stems from a number of causes, such as allergies that affect breathing. Another is the poor nutrition and softness of modern diets, causing toddlers to have underdeveloped chewing muscles and smaller dental arches. Because her upper jaw is too far back, she will struggle to breathe normally through her nose. To get more oxygen, she will compensate by opening her mouth to breathe, bringing her lower jaw down and back, creating a downswing of the face. This is how her undergrown upper jaw creates the appearance of buck teeth. She's actually compensating in order to breathe. If not corrected, the problem carries into adulthood. Extractions were documented in the 1600s as a way to treat crowding. Although they are a quick fix, they don't treat the problem of underdeveloped arches and have been implicated in harming the facial profile, making them the subject of much debate even today. Adulthood. In order to breathe, she will slouch her head forward to prop open her airway, creating a lifetime of neck and back pain. This is the infamous forward head posture. Having a healthy airway is crucial to the survival of life, and especially so during sleep. When muscles around the throat relax during sleep, a healthy airway stays open because the tongue is sitting forward and has enough space to be suctioned up against the fully grown palate. With underdeveloped jaws and dental arches, the palate is too small for the fully grown tongue, which is sitting back to begin with. When she sleeps, her tongue does not suction, rather it falls back and cuts off her airway. This is obstructive sleep apnea. Like crooked teeth, it's a modern condition, however, it can reduce life expectancy. Not surprisingly, obstructive sleep apnea is marked by the same traits that describe the headgear effect. Both jaws are grown down and back, creating a clockwise rotation in the lower third of the face. The myth of the overgrown upper jaw that needs to be held back has long since been replaced with science. Science has shown that young children can be buck-toothed naturally, and that the lower jaw catches up over time with a fully developed upper jaw. Essential to this is nutrition, the use of chewing muscles early on in life, and good breathing habits. This means breathing through the nose with the mouth closed and the tongue resting up against the palate. Also, the practice of maxillary expansion has been shown for over a century to correct crooked teeth and improve nasal breathing space. And since 1918, orofacial exercises have been shown to correct mouth breathing habits.
So very eye-opening, and I hope that helped or helps explain all of the connections that we're going through up so far. So right2grow.org, you can watch that video there. But the result of an underdeveloped airway, an underdeveloped jaws, means that our jaw is set back, our lower jaw does not grow. And so then our tongue, which is attached to our lower jaw, if our lower jaw is back, our tongue crowds our airway, especially when we fall asleep and breathe through the mouth when we're sleeping. And that fragments our sleep. And if we're not sleeping well and we're not breathing well, sleeping affects us at night, but it also impacts us during the day. If we didn't sleep well, sleep deprivation is a really big deal. And it has harming effects on kids, our kids, and kids grow into adults like you and I. So why is nasal breathing so important compared to mouth breathing? We've already talked about the development. When you breathe through the nose, the tongue is in the roof of the mouth, growing the jaws the way they're meant to. When we can't breathe through our nose and we open our mouths, now our tongue isn't sitting up, and it affects our growth and development. Okay. What is the difference between these two? First, we're going to talk a little bit about some research. Dr. Eagle Harvold, who's a researcher at USCF, looked at rhesus monkeys, and he was curious. He was curious, and he asked the question, if I limit or plug the nose, what impact is that going to have on the growth and development? And what he found is nasal obstruction, mouth breathing, and low tongue posture leads to malocclusion in monkeys. So what he did is he took monkeys, he obstructed their airway, causing them to open their mouth. Once they open their mouth and breathe through their mouth and form that habit, now their tongue is sitting down. It's not sitting up. The tongue posture became important, and it put pressure, and the jaws became underdeveloped because the tongue was not sitting where it was meant to. So you can then see that tongue started to protrude and the teeth started changing. Their position changed. Malocclusion occurred. So from this image, when the tongue is sitting in the roof of the mouth completely, both jaws grow down forward wider. When the tongue is not sitting in the roof of the mouth, the upper jaw becomes narrowed. The lower jaw actually becomes wider. It affects our tongue posture, swallowing, nasal volume, mouth breathing, soft diet, bottle feeding, all develop a low tongue posture. And if we have a low tongue posture, the teeth just aren't going to do well. And that's what we as dentists see. Mouth breathing causes tonsils and adenoids to swell because when we nasal breathe, we're humidifying and filtering the air. We're preparing it to be uptaken in the lungs. But if we're breathing through the mouth, now the airway, the trachea, the tonsils, the soft tissue back there takes on all the allergens, takes on all the stuff that we're breathing, all the pollutants in the air. And we're depending on them to filter the air. When our nasal passages, the reason why they're so turbulent in there is we're meant to humidify and warm the air, prepare it for the lungs. Another important feature is nitric oxide. Nitric oxide is a compound secreted by our paranasal sinuses, the lining that make up our sinuses. And that increases the efficiency of oxygen intake and absorption by acting as a vasodilator, meaning it dilates or broadens our vessels, our veins, our arteries. If they widen, now they're more efficient. They can carry more blood. And if the red blood cells that attach hemoglobin, that attach oxygen, if more blood flow, more efficiency. The heart does not have to work as hard, and you have better cardiovascular health. Dr. Sten Linder Aronson, what they looked at, their team, is they took children and they wanted to see if there was a difference. So we have these theories, and so he's testing the theory. He focused on the difference between nasal breathing and mouth breathing. And the outcome was mouth breathing children develop differently, which is what we're talking about. And he made a clinical observation. Nasal obstruction leads to mouth breathing and low tongue posture and leads to higher rates of malocclusion. That's what we've been discussing. So what do we got to do? The thing we do to combat this is we promote nasal breathing. We find out what's the restriction. We encourage the growth of our kiddos so that they don't turn out to be adults with airway, sleep disordered breathing, and obstructive sleep apnea. What you see her holding is called a functional appliance. They wear them at nighttime. They do exercises to strengthen their lips, to seal their lips. And when they're working with this functional appliance and wearing it at nighttime, it encourages them to breathe through their nose. Well, what if they can't breathe through their nose? Well, then we look at the nose and we find out what's the obstruction. If we expand the palate in kids, we broaden the base of the nose, making the space bigger, the volume bigger. Volume's important, and we're going to get to that. So we use functional appliance. So what can we possibly do? Well, we can play catch up. We can recognize the problem. You can recognize the problem in your kids and your friends' kids and make them aware that their jaws are underdeveloped. They're probably not breathing through their noses. And we can train them to do this. We can grow the jaws in kids. Sometimes if we catch it later, we have to play catch up. And we can grow the jaws non-surgically in adults. So it can be done. So what can we do? It might not be what you think. And we're going to talk about that. We're going to talk about the options. So why am I even doing this? Because I see adults and kids in the practice, my whole team does, and we see crowded and crooked teeth, we see underdeveloped jaws, and now you know, and I know, that an underdeveloped jaw means that the airway is underdeveloped. It's not as broad and wide as it was meant to be, meaning the body has gone through layers and layers of compensation. The earlier we catch it in kids, the less compensation occurs. Early detection. So what can your dentist do? What do? We detect it, we recognize it, and we explore it. That's why you're watching this video. So thank you for being willing to listen to this. So what do we do now? What are the options? Ryan, you were talking about options. Well, we're going to get to that. Our options for adults that are non-surgical. Okay, let's start with that category. Adults, non-surgical options. We can go to a PAP machine, positive airway pressure. That can be a BiPAP, a CPAP, an AutoPAP. These machines splint the airway open, preventing its collapse. So they make sure it doesn't collapse, and they have to blow the amount of air at the pressure to make sure that it doesn't collapse. There's an attended sleep study that you would go through. and a technician would turn the pressure and make sure that all the obstructions and all the constrictions of the airway are eliminated. Mandibular advancement devices, that's something that I make. A mandibular lower jaw advancement device is what it says. It advances the lower jaw, mainly preventing it from falling back when you fall asleep. When you go into REM sleep, you go completely atonic. So you don't act out your dreams because you dream in REM sleep. And if you're not dreaming, you're not getting REM sleep, probably because your airway is collapsing. Okay, so we want you having REM sleep, but if your jaw collapses and all your throat muscles totally relax and you obstruct, you're going to wake up. Your body's going to arouse itself so that you wake up and take a breath and breathe so you get oxygen and get rid of carbon dioxide. So they prevent the jaw from falling back. The negative is you have to wear these. You have to do these things in order to get their benefit. And you do it for the rest of your life. But they are viable options. Many people sleep with CPAP machines. Many people have oral appliances. There are costs and trade-offs and compromises with each of these options. The third non-surgical adult option are Vivos appliance. Vivos is a company that has come up with and used research to develop appliances that can grow the airway, expand volumetrically the airway. We can grow the jaws, we can grow the maxilla. It prevents the jaw from collapsing the airway while changing it, while growing it in dimensions. So, when you think of sleep disordered breathing and you think of the treatments, it's easiest, or I think it's easiest, to package it into three categories. We want to prevent the problem in kids. We have control options, meaning it's like a Band-Aid. You have to cover it up in order to get protection. Or resolve. Prevent with kids, control and resolve with adults. Okay? Which option is right for you? A PAP machine, a mandibular advancement device, a Vivos appliance. Those are non-surgical. Okay? Which is right for you? Do you address the root cause as a child, or do you wait to address it as an adult? Remember, there's a lot of compensations that occur. Grow the airway. Do we grow the airway, jaws, and bone, and the position of the teeth? Do we control and wear a machine or appliance for your lifetime? What is the right combination for you? So in prevent, our kids are still growing. So we can recognize the problem and start growing the jaws so that they don't have underdeveloped jaws and in turn an underdeveloped airway. We do this through expansion of the upper jaw, guide oral appliances, the functional appliances, braces, orthodontics, myofunctional therapy. Myofunctional therapy is we broaden the jaws, but then we got to train the muscle to sit there. We have to break the habits of the low tongue posture caused by the bottle feeding and soft diet. The muscles are underdeveloped. We got to work them out. We got to take them to the gym. We got to exercise them. We can control. Control is PAP therapy, mandibular advancement devices. If you can't breathe through the nose, but we can open it up and dilate it, we can use nasal dilators. There's Breathe Right nose strips. All of those things control it. As long as you wear it, it works. And there's also medications. If your nose is stuffy, you can spray Flonase. You can spray certain things to try to help control the inflammation, to control the allergic responses of the tissues in your noses. But it's control. You use it, it works. You don't use it, stop using it, it stops working. Or we can resolve the problem. And there are surgical and non-surgical options in the resolve category, meaning you can have the nose opened up. You can have nasal surgery, make it bigger. Sinus surgery, open up the passageways. You can remove your tonsils and adenoids if they're swollen. If that compensation was done because there were harmful things, we have to remove the compensation in order to get the healing. Vivos appliances, either functional when we're kids or the Vivos appliances as adults that grow the jaws and grow the airway. And then orthodontics, we can move the teeth. There's also surgeries that we actually cut the bone and we expand the jaws surgically. Okay, so surgery, non-surgery for adults impact the resolve category. So I want to go over some cases. This is Vivos. So I can point you in the right direction if you choose PAP therapy. We need to get a sleep study, attended sleep study from a sleep physician and get a diagnosis. So that's one pathway. Second pathway is a mandibular advancement device. Okay. We still need sleep study, still need diagnosis, but the oral appliance is titrated, meaning I try to make it as effective as it can to prevent the jaw from falling back. Okay? Vivos is a non-surgical way where we can grow the jaws. And so the left of the screen is the before. Yes, I know you're seeing teeth. And the right of the screen is the mid-treatment after 6 months. And what I want you to notice is the width of the upper jaw. This is the upper jaw, and the width of the lower jaw, lower jaw. The teeth are much broader. The teeth are much broader, and you can actually see space developed. Now we consolidated the space and we keep it behind those two teeth so it's not visible, so you don't see it. This is that airway of that patient after 6 months. So remember I was talking about volume. So this is a tracing of the airway taken from a CT scan. We have the ability to take CT scans in the office, we trace the airway, and we measure the volume. So we can measure how effective we have grown the airway. And so airways volumes are measured in millimeters cubed, or depending upon the size, centimeters cubed. 26,000, a little over 26,000 before, after we grew it to 28,000 after 6 months. The minimum axial area was 151 and we grew it to 177. Growing airways, developing the jaws. Another patient, before is on the top, after is on the bottom. What you'll notice is there's no spaces on the top teeth. What did we do? We grew the jaw, creating spaces. Then he goes through aligners to consolidate and close the space. But you can see just the width of his lower jaw is much wider. The width of his upper jaw is much wider. All of these spaces create volume, create a space that the tongue can now move into once it's been trained to and gone to the gym and strengthened. This is that airway. 35,000 millimeters cubed to 44,000 millimeters cubed. A lot of change there. Now this change took longer. His mid-treatment was 14 months of treatment. This young lady, if you look at her smile before, you look at her smile after, it's much broader. You can see the spaces between the teeth. She doesn't mind the spaces. She's breathing better. She's sleeping better. We can close the space. We can fix that. But her quality of life is now improved. And she went from 18,000, a little over 18,000 in airway volume to 22,000. Almost 4,000 millimeters cubed of volumetric space. She's breathing, she's sleeping, and feeling much, much better. If only I had known for my girls. A lot of my why I started moving into this is I've got my own story. My 2 daughters, and I've got a 12-year-old and a 10-year-old now. But my 12-year-old, at the age of 5, ear infection. Went to several ENTs. They didn't want to remove her tonsils, said they weren't big enough. Finally, we went to somebody and they removed the tonsils and never had another ear infection. My daughter compensated by sucking on her tongue and pushing her tongue forward, which then moved her teeth. So we had to break the habit with myofunctional therapy. And now she's still in braces to try to get her teeth straight because she was going to breathe and she was going to do anything she could to breathe. And that's the compensation. So we had to uncover each layer to get her fully restored. If I had only known this when she was 1 or 2 or with a new baby. So this is very important. Please share this with other people, this information. What about your child? That's my story. What about you? What about your spouse? Dr. Tara Griffin is one of the first dentists who started implementing Vivos in the Vivos system. And so she's got a story. This is her before and her after. She was her very own first Vivos patient. She did it on herself. She suffered greatly, and she's going to tell us her story.
I'm Dr. Tara Griffin. We are here today in my clinic in Panama City Beach. I've been practicing dentistry for over 11 years. Before I discovered the Vivos appliance, I was suffering every day with chronic head and neck pain, TMJ pain. I was practicing dentistry and been practicing for 5 years, but I was already looking for an out. I knew that with this much pain, I could not continue to practice dentistry. I had chronic sinus and allergy problems, bronchitis. I was not sleeping throughout the night very well. I was waking up during the night. I had severe daytime fatigue where I would need to go home and actually take a nap in the afternoon, just at lunch, And so I was looking for a solution to the problem, but I didn't know what the root cause was until I learned about the Vivos appliance. As soon as I started treatment with the Vivos appliance, within the first 2 nights, I was sleeping soundly throughout the night. My energy was better during the day. The pain that I was undergoing took a bit longer to get resolved, but within the first 3 to 4 weeks, my pain level was reduced by 2/3 or more. Within a month's period of time, I was breathing through my nose better. I wasn't having the same sinus symptoms that I was having before. And within 3 months of treatment, my asthma had improved so much, I had no more problems with the inhalers and the frequency I was having to use with all of my asthma inhalers. My overall health started to improve very quickly. I was my own first patient. However, as I continued to treat the next patient and the next patient going forward, I was curious to see if they were going to have the same outcome that I had, and they did. 9 out of 10 had the very similar outcome that I had. So they were sleeping better in just a few nights, actually getting their energy back. They were less irritable. The pain that they had was going away very quickly. The teeth were beginning to straighten and align over time. So even though with this type of problem, it can take some time to get the long-term results, the immediate symptoms start to improve very quickly. Comparing my before and after picture with the Vivos appliance, my smile was not symmetrical. My teeth were crowded. The gumminess of my smile was a major problem that I didn't like. I had unevenness in my eyes, also in my nose. My face was more round and less balanced, and that all helped to correct itself as well as I went through the treatment. When the Vivos appliance is worn in the early evening while you sleep at night, it allows the jaw to relax. It allows the airway to open up. It allows you to breathe through your nose and to get the oxygen that you need to the rest of your body for your body to begin to heal. By breathing through our nose, we are actually getting much more oxygen to our brain as well as our lungs. And we're producing nitric oxide, which is a vasodilator to allow the blood flow and everything to circulate better. And so a big component with this is it forces you to actually breathe through your nose to get the oxygen where it needs to go into the body. So that's a very important part of this. If you're interested in learning more about the Vivos appliance, if this would be good for you, then I recommend you coming into a Vivos center to be evaluated to determine if this is something that can help you.
So yes, that's Dr. Griffin's story. And she got amazing results. A lot of patients get amazing results. And again, it's those layers of compensation. Everybody has a unique sequence. This is her airway. This is why she experienced the improvement. It took her 15 months to get there, 15 months to get there. Her airway grew from 7.7 centimeters cubed to 24.1. 120 cross-sectional matrix to 276. You can see the restriction and now the size of her airway. This young lady that went through treatment, and these photos kind of chronologically show you throughout time. The change in her face is subtle. A lot of people are like, how's it going to change my face? You're growing bone, oh my goodness. Just look at the subtlety of it. She looks like a sister, but it's still her. She loved the results. This is another young lady that went through treatment. She, like Dr. Griffin, didn't like her gummy smile. And as her maxilla was broadened, it changed the way the muscles fit and draped her face. This is her smile after. This is her profile before, her profile after. Her lower jaw developed more. This is what she had to say. When smiling, I notice I am now physically unable to smile as big as I used to. My gums are now barely showing. My face feels different when I smile now. I don't know how to explain it, but it is a great thing. When I speak and eat, my jaw no longer pops. I can speak more clearly and feel a noticeable difference in the amount of room my tongue has. I can breathe very well through my nose now. I am very happy with the results. So Vivos, yes, it's an appliance, but it's a part of the solution because we have to uncover the compensations. We first promote healthy nasal breathing. We've got to get you breathing through your nose. We have to train and strengthen the tongue and the facial muscles to help you breathe through your nose. Train the tongue to sit in the roof of the mouth. And we've got to eliminate bad habits in our kiddos by using the functional appliances. So if there's an abnormal swallowing pattern, if there's a low tongue posture, through the series of appliances that we do in kids, it trains to no longer thumb or finger suck. If there's a tongue thrust, we train the tongue to sit up, not shoot forward. And there's something called a reverse swallow. Swallowing, we swallow all the time. If we train swallowing patterns and get the tongue strong, it acts as a brace. So, what do we do with Vivos? Whether you're a child or an adult going through the process, there's questionnaires, we take CT scans and photos, and we get an airway intelligence report. So we do this at the beginning, mid-treatment, and at the end. So in the beginning, we take scans and photographs and data gathering. And at mid-treatment, we do the same thing because we want to see what is changing and what is the impact the change is having on you as an individual. So we track that. There are clinical advisors that advise me and my team throughout the process. I speak with a design specialist on your appliance because every appliance is different. I have appliances. I am growing my airway and my jaws, and my appliance is going to be very different from your appliance because it depends upon the objectives. It depends upon the data, the CT scan, the photographs. It depends upon what dental work you have, how many teeth you have. So there's a lot of variables that go into this appliance. So this is a video, and I want to preface this video with all options are viable. I am not here to sell you on any one option. The Vivos option is a great option if you're committed, compliant, and wanting an end in mind. Okay. The oral appliances they show in this video, they are smaller, sleeker. Okay. The CPAP machines, they work great for some people. If that's the option that's best for you, I'd love to help point you in that direction. If you want an oral appliance, I would love to help make that for you. And I'm a believer in the Vivos appliance because it changes the structure. It changes the underlying issue. So let's watch this and we'll talk some more.
I really feel like Vivos is one of the great answers to the healthcare crisis that's in America, because we're getting to the root cause of what ails a lot of us, and that is not breathing well and not sleeping well.
If you trace back the journey of a sleep apnea patient, that patient is suffering for years before they ever get diagnosed. Once they are diagnosed, they're presented really with two fundamental options. You can go into CPAP and wear a contraption over your face every night for the rest of your life, or you can have what's called a mandibular advancement device, which will actually protrude your lower jaw in an unnatural position to hold your airway open while you sleep, and you can wear that for the rest of your life. Either of those two modalities are going to present that patient with a life sentence of having to wear this contraption, one or the other, every night for the rest of their life.
The interesting thing about CPAP and oral appliances is, although they're very effective treatments, if they're used over a lifetime, the person's condition actually gets worse over time.
Along comes Vivos and says, wait a minute, we have a better option that's all natural, non-invasive, non-pharmaceutical. We can say to a patient, you go into this oral appliance therapy with our protocols, and you go through this treatment for 12 to 24 months. And at the end of that time, there's a high probability that you will no longer have to wear an appliance or any kind of device.
Vivos is literally changing my patients' lives.
It has drastically changed my life. I don't have to use the CPAP anymore. Within just a couple weeks of using the appliance, I was able to breathe through both nostrils, something I couldn't do my entire life. This was revolutionary. Pretty much made me feel excited about life again.
She's sleeping better, I'm sleeping better.
You really feel like you've been given a new life.
It's amazing. I wake up and I'm not in pain.
Because she's sleeping better, because her attitude during the day is better.
I have a better quality of life now. I can't say enough good about it.
I'm getting instant benefit from it. I was amazed. I dreamed every night for 2 weeks straight, and I told my wife, I said, it's amazing. I feel sharp now. I don't feel drowsy all the time. It's been a long time since I felt this good. I wouldn't lay down and try to sleep right now without my Vivos device.
My asthma has gotten much, much better. Without the Vivos, I wouldn't be outside right now. There's no numerical value you can put on this kind of a change. I smile. And I haven't smiled for a long time.
Right after I started using it, I noticed the results really, especially with the snoring. My sleep apnea episodes are a fraction of what they were before. This product's phenomenal. It changed my life.
It's a very comfortable process, but I can see dramatic differences. Now I can really open my mouth. Before it would almost always click.
His ADHD is calming down, he's doing better in school. I can definitely see the difference and the change in him. It's a miracle.
I get to do things now that I would not have been able to. I would not hesitate to do it again.
I am 100% happy that I did this, and I'm thankful every day that I have it because I can breathe.
We bring hope to the millions of people and the millions of families, men, women, and children who suffer from this disease.
It promotes the body's own ability to heal itself, because now the body can breathe and sleep well. That's exciting.
So now that we've gone through why the underdeveloped jaws, because of diet, cultural reasons, and there in turn the underdeveloped airway causes us to not breathe well, sleep well, and then you and I can't be the people that we were meant to be. So what's the next step? Okay. If this is something that you're curious about, you would come in and you'd see me and the team, and we would spend 45 minutes and we would give you a screening device for 2 to 3 nights The cost for this is $166 for those 45 minutes, and the sleep screening where we get baseline values and see whether or not we need to investigate further. We also take a CBCT scan because I want to view and see the airway. And basically from this information, we can decide sleep physician with a sleep study, attended sleep study, and a CPAP machine. We could talk about a mandibular advancement device. We could talk about Vivos. We could talk about surgeries because I'll have imaging to be able to see what's going on. Okay. This is basically the precursor. Okay. This kind of lends us to know a little bit more and see if you're even a candidate for Vivos. We got to see your teeth. I've got to meet you. You've got to meet me. And if you already have, if you're a patient and you've already done something like this with me, then it's just up to you to decide now which route and which option do you want to explore more. So if you do Vivos, so if you do the screening, and if we say yes, Vivos will work, I would see you after that consult appointment. I would see you for about an hour and a half appointment where I gather the rest of the information. I review your CT scan. We view your airway. We take a bunch of photographs and images. We do a very, very detailed examination to get diagnosis codes. We look at and we generate an error report. We do a consultation, and then sometimes we get a diagnosis from a sleep physician looking at your sleep screening to give us a diagnosis of what's going on. And then we will order, based off all this information, we will order the appropriate appliance and use a rescue appliance. So if we do the screening and we see that you have obstructive sleep apnea, we don't want you waiting. We don't. A rescue appliance is something we can put in immediately to give you immediate relief, at least some relief. And depending upon the severity of it, Vivos might not be appropriate for you. We might need to get you to a sleep physician ASAP. And it depends. Everybody is different. Okay? So, a PAP machine. The cost varies depending upon your medical insurance and what they cover. A mandibular advancement device prevents the jaw from falling back. It's something that works. PAP works. They both work well, but you've got to wear them. The cost for that is around $2,500, and that covers every appointment for the first 3 months. I've got to titrate and get it working well, get it adjusted well, so that you're sleeping better and feeling better. That process generally takes about 3 months. Or there's the Vivos appliance. It grows the airway non-surgically and prevents the jaw from collapsing while growing the bone, growing the airway. The cost for that, because this is kids and adults, is anywhere from $3,500 to $8,500. We'll get a little more detailed on that. So, is $3,500 or $8,500 a lot of money? Yes, it is. We are growing your airway. We are changing your life. That's what you will initially pay me and my team to do. This is a very low cost compared to surgery. It is dependent upon you. You and I will partner in this because I'll do everything I possibly can to get you healthier. And you've got to choose health. You've got to choose it for yourself. You've got to choose a better future and write a better future for yourself. The Vivos appliance is the only appliance that has an end point to it, meaning you can stop wearing it. Once we grow the bone, you can stop wearing it. And depending upon your level of apnea, you may or may not get to stop wearing a machine, a CPAP machine. Because we can grow your airway, but we've got to analyze and see where you're at now at the end of treatment compared to where you were. So there's diagnostics involved in that. I will say the majority of Vivos cases need some degree of orthodontics at the end of it. That is not included in the $3,500 to $8,500. We're catching growth. We're growing the body. We are decompensating for compensations that occurred. Okay. At the end of it, if you so choose to then straighten, consolidate space, fill space in with restorations or veneers or crowns or something along those lines, I can do that too and help you with that. We don't know before where those spaces are going to be consolidated. It depends upon how your body and how you as an individual grow. We're going to get the airway and the jaws right. We're going to grow the jaws. We're going to grow bone, grow the airway, and then we can align and straighten the teeth and get your bite lined up. So, more details. For adults, $8,500 for Vivos. It includes the process. It includes the diagnostics. It includes the appointments. It includes myofunctional therapy if needed. If your tongue or your lip needs to be released, it includes that. Time is 12 to 24 months to get your bone grown. And you must wear the appliances at least 12 hours a day. If you wear them 16 hours in a day, you will grow faster. Okay? You will grow more consistently. So that gives you 8 hours where you cannot wear the appliance. And compliance is important. We typically will see 1 millimeter of growth for every month of wear. And that's the best that we've seen. It can be less than that depending upon how you grow. Children, it's $3,500 to $4,250. Depends upon the age and depends upon when we catch this. So do we have to play catch up? Sometimes we have to have a palatal expander. We grow the upper jaw, getting it to where it's meant to be, and then we start the functional appliances. So every child is different. We have to explore and take a scan and take a visual of your specific situation and see where your child lands within this continuum. Okay? So, what is your combination? Because we are all different. We all have a unique sequence. And we have all had years of compensation. The older we are, the more layers we have to unfold. So what's going to happen when we start unfolding them? It's exciting because everybody responds differently to it. Whether you're having pain, TMJ issues, whether you're fatigued, you're tired, you're not sleeping well, you're not resting well, you're dealing with a lot of pain in your body. Could it be that you're not sleeping well? And that is the overarching thing that's affecting other areas of your health. Your heart is having to work too hard to oxygenate your body. It's not good for you. This is a way forward that can help with all of those symptoms, and we decompensate the compensations that have occurred. So, I want to thank you. I want to thank you for your attention and viewing this video. You can call the team if you've watched this. Please feel free to call the team to schedule your consultation if that's what you so choose. We can point you in the right direction. We work with several sleep physicians. I work with ENTs. I work with oral surgeons. So if surgery is correct or the non-surgical approach, if you want to go get an attended sleep study, overnight sleep study with a sleep physician and get a CPAP machine, I and my team want to serve you and help you in any way that is best for you right now. And no for now to one way doesn't mean no forever. And yes now for one way doesn't mean yes forever. So we want to help you. We want to serve you. If there's anything that we can do, you can call us. My name is Dr. Ryan Robertson. My team is RR Dentistry and RR Airway Health. And thank you and take care of yourself.